Senator Storm, Senator Webb, Representative Bray, Representative Decker, Representative Kulkarni, Representative Sharp, Senator Mays Bledsoe, Senator McDaniel, Representative Bowling, Representative Elliott, Representative Petrie, Representative Dietz, Chair Funky Fromeyer.
Perfect.
Good morning. I'm Foster Cutoff. I'm a district judge in Christian County.
And then Judge Gabhart is joining on Zoom. I don't know if she is on. So we'll go ahead and get started. Yep. Sorry. We'll go ahead and get started, and if she joins, we'll recognize that she's on. All right. Good morning, and thank you all for the opportunity to appear before the subcommittee. I'm Audrey Collins, Executive Officer of the Department of Specialty Courts. And with me today should be Judge Catherine Gabhart of the 14th Judicial Circuit. Judge Gabhart serves as Adult Drug Court and Mental Health Court Judge in Bourbon, Scott, and Woodford County. And also joining is Chief Regional District Judge J. Foster Cutoff of the 3rd Judicial District. He serves as Veterans Treatment Court Judge and Mental Health Court Judge in Christian County. Both of the judges are going to be sharing their experience as specialty court judges later in the presentation. On behalf of the Department of Specialty Courts and the Administrative Office of the Courts, we appreciate the chance to share the impact of our work, highlight outcomes, and discuss the continued need for strategic investments in courts that hold individuals accountable while supporting long-term recovery and public safety. Kentucky Specialty Courts, which you may notice on the slides being referred to as SPC, have a mission to restore lives and reduce recidivism through judicial oversight and behavior modification. The foundation that drives specialty courts is something called therapeutic jurisprudence. Therapeutic jurisprudence, often called TJ, is a legal philosophy that asks us to consider how our legal practices impact the emotional and psychological well-being of the judicially involved. It promotes accountability while also building dignity, hope, and meaningful change. The goal is to foster the opportunity for the individual to become a productive member of society. That is the core of what specialty courts do. Specialty courts address the whole person, and we consider the root cause of what led to criminal behavior and what supports they need to intervene and reduce their likelihood to recidivate. I'm trying to change there we go. Aligning with national best practice standards, all 3 types of specialty courts throughout Kentucky serve individuals identified with high risk and high needs. Those are individuals who are likely to reoffend without intervention and who have significant therapeutic needs. Adult Drug Court is our largest model with over 2,600 active participants, and that court serves individuals with substance use disorders. Mental Health Court currently serves around 232 active participants, and the court focuses on individuals with serious mental illness or co-occurring disorders. Veterans Treatment Court has around 103 active participants, and it's designed for military veterans and service members with identified behavioral health needs. Altogether, nearly 3,000 individuals are actively participating in Kentucky specialty courts. Specialty courts, also known as treatment courts in other areas of the country, operate in every state in the United States. In Kentucky, we've been a leader in establishing well-organized courts that follow unified administrative procedures, maintain fidelity in practice, engage strong community support, and are both sustainable and replicable. Kentucky specialty courts operate all across the Commonwealth, providing critical support where it's needed most. Adult drug courts operate in all 120 counties. Mental health courts operate now in 17 counties. And veterans treatment courts are strategically placed in 8 counties across the Commonwealth. In total, 2,991 participants are currently receiving the structure, treatment, and accountability these courts provide, therefore reducing recidivism, promoting recovery, and strengthening communities. So what makes specialty courts effective? First, our work is backed by research and evidence-based practices in both behavioral health and public safety. And specialty court takes a holistic approach. Participants need access to a continuum of care that supports their physical, mental, and emotional well-being. This includes community supervision, treatment, recovery supports, employment services, housing referrals, and much more. Specialty court staff connect the individuals to the appropriate services and monitor their adherence to treatment plans and case plans. Specialty court is built on a collaborative, individualized supervision and case management. Our team and staff work together to create supervision and treatment plans tailored to each person's strengths, needs, and risks. Specialty court staff provide the case management and supervision to each participant. And finally, court decisions are made with a multidisciplinary team, which means that judges aren't making decisions in isolation. Judges like Judge Gabhart, featured here with one of our staff and a graduate, are surrounded by a team of professionals. The foundation of a successful specialty court is its multidisciplinary team. Led by the judge, these teams include specialty court staff, defense attorneys, prosecutors, treatment providers, law enforcement officers, and often other representation from community resources. Specialty court staff develop individualized case management plans and monitor participants' progress, while judges and team members often volunteer their time to serve these programs. One of the most distinctive features of specialty court is the regular, direct interaction between the participants and the judge. At each status hearing, participants appear before the judge to review their progress. This ongoing judicial engagement is identified by the National Association of Drug Court Professionals, which is now known as ALRISE, as an essential element of effective programs, which builds accountability, trust, and motivation. Participants frequently cite their relationship with the judge as a major factor in their success, which is underscoring the unique and transformative role of judicial involvement in specialty courts. In Kentucky, according to the Vera Institute, the annual cost to incarcerate one person is over $16,000, which is roughly $44 a day. In comparison, specialty court participation costs around $6,508 per person, or just $18 per day. The average length of participation in a specialty court is 2 years. Every dollar saved through specialty court participation is a dollar that can be reinvested into the recovery services, job training, housing support, and community safety initiatives needed. And the savings are, of course, not just financial. The individuals in our courts are receiving treatment, reuniting with families, finding employment, and building stable futures. The chart here highlights the financial impact of specialty courts by showing court-ordered obligations collected from participants over time. All individuals in specialty courts are required to pay any court-ordered fines, fees, and restitution. Court-ordered costs, fines, and fees go directly back into the general fund. Participants consistently fulfill child support obligations, with over $1.3 million paid between 2020 and 2024. More than $963,000 in restitution has been paid over the last 5 years, providing tangible reparations to victims and helping restore trust. Other obligations, such as court costs, fines, and fees, account for the largest share, totaling over $3.1 million. And over the past 5 years, participants have paid more than $5.4 million in child support, restitution, and other court-related obligations. That's money that's going to directly benefit victims, families, and communities. Unlike incarceration, specialty court allows individuals to remain employed and meet these obligations, reducing the burden on the taxpayer. Here's a total spending overview for the department and some additional information on our top expenses that make up that total. Our total budget for fiscal year 25 was $18.6 million. $9.5 million of that total was dedicated to personnel. We have around 178 staff members, and 80% of those are directly in the field, working directly with participants. We invested $682,000 directly into treatment services, partnering with community-based providers. This ensures participants have access to evidence-based clinical care that supports long-term recovery. AOC contracts with each of the Commonwealth's 14 community mental health centers to ensure all participants have access to therapeutic services. We also dedicated $4.47 million to drug testing, ensuring our specialty courts operate using scientifically valid, forensically defensible, and therapeutically beneficial results, which are critical to maintaining accountability and integrity. Looking at specialty court outcomes, here you're going to see a 5-year comparison of 3 of our key metrics. You're going to see referrals into a specialty court. Those are going to be in blue. Entrances into a specialty court are going to be in orange. And successful completions of a specialty court are going to be in green. From 2020 to 2024, 7,658 individuals entered a Kentucky specialty court, and 4,384 successfully completed. Each completion reflects a life changed, less likely to recidivate. Now, it's important to remember that recovery is rarely a straight line. Research shows it often takes several attempts at treatment or recovery before someone achieves lasting stability. This means it isn't completely unexpected when a participant doesn't successfully complete a specialty court. Relapse or re-engagement isn't failure, and it's part of the process. Our goal is to provide the opportunity for change and provide accountability with compassion. For those who don't successfully complete specialty court, often experience positive impacts either way, such as increased access to treatment, improved housing stability, and greater connection to community resources. Nationally, drug court completion rates range from 40 to 60%, and Kentucky consistently performs at the top of that range with an average completion rate of 57% over the past 5 years. That's demonstrating both the strength and consistency of our courts. Since 2019, specialty court staff have helped over 5,100 participants secure employment. Employment not only means that participants are productive contributors to our community, but it also provides purpose, structure, and stability, which are all critical elements of long-term recovery. More than 1,600 participants have earned job promotions during their time in the program, which reflects career growth and self-sufficiency. In that same time period, 404 drug-free babies have been born to participants, which is changing the trajectory for those children and their families. Beyond employment, specialty courts have supported participants in achieving other important milestones. 555 participants achieved educational goals, such as earning their GED or pursuing higher education. 1,621 have secured improved housing, and 2,025 participants regained their driver's license, increasing their independence and access to work and family responsibilities. The slide here shows recidivism rates for participants who successfully completed a specialty court between January 1st, 2019 and June 30th, 2022. The data shows that most graduates do not return to the justice system. Within 6 months, only 4.89% were rearrested, rising to 10.95% after 1 year, and after 3 years, more than 70% of graduates had not been rearrested. Just 2.06% were reincarcerated within 6 months and 6% within 1 year. And after 3 years, fewer than 1 in 4 had returned to incarceration. When compared to Kentucky's general recidivism rate of 30.81%, which is a 2-year measure, specialty court graduates clearly outperform the statewide average, demonstrating the program's significant impact on public safety and long-term behavior change. I would also like to note that a statewide evaluation of specialty courts is being conducted by Morehead State University at the moment, and we are going to look forward to sharing those results once they're made available. The map here shows all AOC-funded mental health courts across Kentucky. Thanks to strong legislative support, mental health courts now operate in 17 counties across the Commonwealth, currently serving around 232 active participants. I say around because that number is growing every day because the programs are newly implemented. Each participant receives intensive supervision, behavioral health treatment, and the structure needed to reduce recidivism and support lasting recovery. This is helping individuals who might otherwise cycle in and out of jails, hospitals, and crisis systems. The map you're going to see in front of you is color-coded to show the previously established mental health courts prior to 2024. You'll see that there were only 3. In yellow, you will see the current grant-funded courts. That's in Warren County and Johnson County. We currently have federal grant funds to support those. And in green, you will see the newly implemented courts made possible by legislative funding. In addition to expanding mental health courts, legislative funding also allowed us to place behavioral health liaisons statewide. The 8 liaisons connect individuals experiencing complex needs such as mental illness, substance use disorder, and intellectual or developmental disabilities to the right services. The behavioral health liaisons work closely with law enforcement and justice partners to divert individuals away from judicial involvement and towards treatment, therefore reducing future criminal justice involvement and strengthening community safety. The photo here shows Circuit Judge Judy Vance Murphy at a specialty court graduation in 2022. Twice a year, we survey specialty court participants to better understand what's working and where we can improve. The feedback reminds us that behind every statistic is a real person whose life is being transformed. One graduate shared that drug court brought me a long way in life to be the man I am today and a provider for my family. The appreciation reflects the hope that participants gain through structured support, accountability, and compassion. Testimonies like this reinforce that specialty courts are more than a diversion from incarceration. They're life-changing interventions that can restore lives, families, and communities. And with that, I'd like to turn it over to our judges to share their insight. I'm not sure if Judge Gabhart has been able to log on. And so, Judge Cutoff.
Good morning again. Judge Gabhart is actually at a conference for specialty courts out in Boulder, Colorado right now, so her alarm may not have gone off. I don't know. It's early out there. I'm Foster Cutoff. I'm one of the 2 district judges in Christian County, and I do have the privilege of being the Veterans Treatment Court and Mental Health Court judge for my county. Madam Chairwoman, thank you for having us here today. Members of the committee, we really appreciate you listening. I'm just here to tell you, from a judicial perspective, specialty courts are great. We can't get enough of them, really. Veterans Treatment Court is super important where I live. Fort Campbell, the military base, is partially in Christian County. It's partially in Tennessee. We have a lot of soldiers, a lot of retired soldiers who live in the community. And unfortunately, some of them get in trouble. Could be a DUI, it could be something more serious. Veterans Treatment Court's a little different than, say, drug court, which deals with substance use disorder, obviously, but we deal with substance use disorder. We deal with PTSD when these soldiers come back from overseas and they're dealing with things and they don't know how to act appropriately based on that. TBIs, traumatic brain injuries, we have people with that. I have men and women. Right now, I probably have 20 people in my Veterans Treatment Court, and we meet weekly. With some of them, they phase up and they get to come every 2 weeks, every 3 weeks, every 4 weeks, whatever. But we have a great staff. The people in our building who do our Veterans Treatment Court, the AOC employees, are wonderful. We have prosecutors, public defenders who are on the team. We have mental health providers who are on the team. But the big thing with Veterans Treatment Court is we partner with the VA out of the Nashville, Tennessee area, and they come up every week, and they provide moral recognition therapy to our folks, and they provide guidance, and they help them get benefits. They connect them with their service-related benefits that they may or may not have known that they were even entitled to. And it's just really great. I had a 60-something-year-old man the other day. He's been out of the Army for 30 years. His body's all beat to heck, and he's trying to do some jobs here and there, and he just can't keep a job. And they got him service-connected, 100% disabled, and he's now drawing $4,500 a month. He probably should have been for the last 10 years. He had no clue. So they're really making differences in people's lives. I didn't serve, but in Christian County, we have a great respect for those who do, based on the military base being right there, and we see soldiers in court for better or worse every day for various things, and their lives are difficult as it is. So this is one of those things that we can give back to them and provide them support. 8 veterans treatment courts around the state. I'd love to see more. I would love to see more. I know there are veterans in other places besides Christian County. We are blessed in Christian County. I think we're one of 4 counties that have all 3, drug court, mental health court, and veterans treatment court. So we do have all of those resources, and we thank you for that. Your last judicial budget gave us those 10 new mental health courts, and we were designated as one of those. So we started that in February of this year after ramping up, and we now have double-digit participants in that. That is a different deal altogether, dealing with people with severe mental illness, serious mental illness, because you have to have an SMI to qualify for mental health court. We treat that court a little bit differently, and those participants partner with our community mental health center. Pensacola Mental Health Center does it in Christian County, and they're provided all kinds of services, and we assist with housing, we assist with benefits. Some of them have state guardians, so we're helping them get their Medicaid, we're helping them get their food stamps, things like that, keeping them off the streets, keeping them medicated if they need to be medicated. All of that is looked after by staff and by our partners. And for some of these people, if that was not available to them, they would be off their meds. They'd be in and out of jail like I've seen some of them for the last 10 years. And it's just great to see the progress that they make. When I practiced, I had many of my clients go through drug court. Drug court works. That's the motto. It does work. Not everybody graduates, but I think everybody gets something out of it. But having judicial oversight over people for a couple of years, 15 months minimum in veterans treatment court, you really see changes. And when we have graduations, we celebrate. I mean, people will come up there and give their testimony and tell what happened that fateful night or day, whatever they did, and how they've gotten over it, and all the resources that have helped them. And it's a wonderful thing. So we appreciate any assistance the legislature can give to specialty courts, because it's truly a great thing for the citizens of the Commonwealth. And it's not for everybody. It's not. Some people don't need to be in a specialty court. Some people don't qualify to be in a specialty court. But for the ones that do, we can make a difference, and I think we are. So I wanted to tell you, Monday night, I was taking my 21 and 19-year-old kids through a drive-through somewhere, and they, paid, and they told us to pull up, wait for our food, whatever. So pulled up, and the person who brought it out, I lowered the window, and it was one of my VTC graduates from about 6 months ago. And he just, "Judge Cutoff, I'm doing great. Good to see you. I've kept this job," and blah, blah, blah. I mean, and he didn't start out real great in the program. He and I didn't see eye to eye on a few things, and had a few sanctions here and there, and he was in the program a little longer than normal. But he had served overseas, had an alcohol issue, had some PTSD, had some issues in his marriage, and he's fixed them all, and he's kept employment, and he was just tickled to tell me that he was doing great. And my kids are like, "Who was that?" I'm like, "Well, somebody I know from court." Mm-hmm. So stuff like that makes me know that we're doing a good job. So if you have any questions about anything, specifically Veterans Treatment Court or Mental Health Court, I'd be happy to try. So I'm still learning the mental health court stuff. It's relatively new.
Great. Thank you, Judge Cutoff. And I do very much appreciate that testimony as well. The recognition that you are a professional mentor, as well as providing a degree, perhaps, of accountability. I did want to ask kind of specifically, are you able to get to the root cause of the issue that landed them in court and work around some treatment to some of the root cause wellness? I recognize a veteran served, but recognizing how to get them to full health and well-being.
And with Veterans Treatment Court specifically, a lot of times we're relying on the VA with their medical history. We have lots of veterans who come into VTC and they're struggling, and we send them to RRTP, and I can't tell you exactly what that stands for, but they'll go to Murfreesboro for 28 to 60 days and get some help down there. But so we do have to send people to treatment sometimes in the middle of their specialty court stay, and we just put them in suspended status, or we might give them a little credit, but they go and they get treatment inpatient, and then they come back, and hopefully we can start over and start from there. But yeah, we're always trying to figure out, it could be a soldier who's 20 years old who went out and got drunk and they drove and they were just stupid, and they're doing VTC to better their lives, and some of them they're doing it so they can stay in the military. They don't get kicked out if they complete Veterans Treatment Court. We run into that a lot. But some of them have some deep-rooted issues from being overseas, or they have alcoholism or drug dependency that they're dealing with. So yeah, I don't necessarily find it. I'm relying on my team, and I didn't stress that enough. It's weird to say I'm just the judge, but I'm just the judge. I see these folks in court once a week or every 2 weeks or whatever. It's the staff that deals with them on a day-to-day basis, that checks in with them. It's the mental health providers. It's the VA. Those folks are the real heroes. They do everything. We walk in and they stand up and they listen to us because they know I can put them in jail if they mess up too much, or I can sanction them, or I'll fuss at them. But typically it's praise. It's that black robe effect. They want to please a judge. They want to make sure that we're happy, and I think it works for the most part. When people phase up, they finished one phase and they move to the next phase. Everybody claps. I give out candy bars. We give them certificates. We acknowledge their successes. We had a guy the other day who's 12 months clean, and he 60-something-year-old man lives in Muhlenberg County. And that's another thing. We take transfers from other counties around here because other counties don't have VTC or don't have mental health court. So we'll take a transfer from another county. So we do provide services to other counties. But he said, if you told me a year ago I wouldn't have had a beer in a year, I'd have told you were crazy. Because he was a 30-pack-a-day drinker is what he said for a long time. I don't even know how that's possible. But he's doing so well. And he just thanks us all the time. And I'm like, well, thank you. You're doing what you're supposed to. So it helps. But I'm that part they see for 30 minutes a week. And I know my role, and I know my role's important. But Audrey and her team back here, and everybody from AOC is back behind theirs with specialty courts. They do a great job. And the people in my building do a great job. My behavioral health liaison for mental health court for my region, her office is right down the hall from me in the Christian County Justice Center, and I've known her for years, and by gosh, she is in my office 3-4 times a week. Judge, I want to talk to you about this. Judge, I want to talk to you about that. So, okay, Janice. And we talk all the time, and she's got wonderful ideas. So I'm just along for the ride and happy to do my part. So
much, and I know we do have several questions, and of course we want to get to a deeply rooted understanding of what the costs are as we're moving towards a budget session as well. Co-Chair Dietz?
Thank you. I have a couple of questions. I think one, if you're able to go back to the screen, I can't remember which slide it was, and it showed it was child support, it was court costs, and it looked like, at least in 24, that collections had gone down. And it looked like a pretty big dip. Yeah, right there. Do you know why that dip has occurred?
I can't tell you the exact reason why it's occurred. Of course, there is the possibility in 2024 we started a overhaul of our case management system. And as we worked through converting from that case management system to our new case management system, I personally do think it's possible that that could have impacted the data that was collected. But I don't have any specific reason why that number is less than. So what's important to know is that the Administrative Office of the Courts provides the general oversight to all of the counties that are operating. And then on a local level, the judges do have discretion to make any adjustments that they need to anyone's requirements. I'm not aware of any type of trend of costs not being required to be paid or anything like that, though.
We always require people to pay their restitution because there's a victim out there who needs to get paid, but sometimes circumstances would dictate that they don't pay their court cost. They're indigent still, so we're going to waive those court costs. Now, I don't know what would make the green line drop that low, but restitution-wise, that's just, I've got 2 people in VTC right now paying restitution, and I keep reminding them they will not graduate until they've paid that. And they knock a little bit down every month, so they're doing what they're supposed to. And I do have a couple of people paying child support also. So, but as far as the other court costs, they're not my biggest concern, to be honest. So.
Right. I was really more concerned, I think, seeing that child support number dip that much. And if you think it's the reliability of the data, do you think by the time we get back in January, you would have the numbers for?
I think we can pull. We'll also have numbers for this current year as well, so we can pull some more information for you on that. Yes.
Okay. And if I could, I have a second question. As we get into the budget year, I guess I'm curious, and we're talking about 3 specialty courts today, and maybe you can tell me, are they set by statute or by rule? And then the funding, as we move into what the asks are going to be, I think there's always concern on the House side that sometimes these are created and they're funded maybe from money that's been put in it to a different pot, and then there's an ask from us to continue to fund those as we move forward, maybe without legislative creation. So I guess if you could speak just a little about that and give us some history on that, that would be helpful for me.
So, and I don't have the statute in front of me, but I can provide it for you so you have it. But there, we are required to provide the supervision for anyone who has entered into a drug court, as opposed to probation and parole. So thinking of that statute essentially aligns that because drug courts exist, instead of the supervision being done by probation and parole, it's done by drug court staff. And so $15.1 million of the $18 million that you saw is from general funds. There are around $1.7 million in restricted funds, and then about $1.6 million in federal funds. So those are grants that the program has been awarded to operate on any large initiative that we may have. So, for example, our case management system upgrade was supported by grant funding. And because we would not have the funds available otherwise. And then we are our drug testing budget is budgeted for every year. Our treatment costs are costs that are the result of what Medicaid does not pay. So participants that are going to the community mental health centers, Medicaid will pay for their treatment typically, and if they do not pay, then we had those contracts cover the rest. So that $684,000, I think it was, that you saw, is whatever is left that Medicaid does not pay. So anyone who's privately insured or does not have Medicaid coverage, we will pick up the cost of those. And so, if you would like some additional information around just the exact structure of the budget, we can get that to you as well.
If I may, I don't know that it's the exact structure of the budget. It was more the creation of the courts itself.
Yeah,
and if you can talk about that history of the
Mm-hmm.
of those.
Yep. So specialty courts in Kentucky began around 1996 as a pilot court. It started in shortly before, around 1994, 1995. In Miami-Dade, Florida, the operations of a drug court came to life. And so they started with several pilot programs in Kentucky in 1996 and continued to expand. Most of those started with federal funds. And we saw success very early on. And so then we also were supported by some Unite funding as well for several years. And so I would say, and I don't have the exact number in front of me, but I would say around 2008, maybe 2009, there was a shift from all of those drug courts and being partially funded federally to a shift for state funding to support all of those courts. And when I say support all of those courts, it would be to staff them to be able to cover the drug testing that's required for them, the maintenance of our data system and things like that. The judges and the teams do not receive any financial benefit from participating in the court. So ensuring that everyone has access to drug treatment and the testing. So it was around that time that they became fully state funded. And then over time, we have worked to be as efficient as possible with the staff that were available to us to find ways to expand. So we will, as we have looked for opportunities to expand more veterans treatment courts, for example, some of the barriers are that we need to be able to adequately staff our courts. And we need to ensure that we're able to do so in a way that is not going to harm our outcomes or anything like that. So you'll see that there's 8 veterans treatment courts, and that's for a couple of reasons. One is we need to make sure we have the veterans in the area to properly serve, and the other is that we need the funding to support additional staff. And so we look for one staff person for around 25 participants. We can have a few more for staff for case management, but it does become challenging, especially with mental health court. Veterans Treatment Court first became operational in, I would say, around 2012, 13. I'll get you the exact numbers. And that is kind of just using the same philosophy of drug court, as this is a specific population that the court is seeing repeatedly over time that has specific needs, and you can take that drug court model where research has shown it's effective and apply it to this specific population and have positive outcomes. Same concept with mental health court. There are lots of other treatment courts across the nation. You'll have lots of specialty courts like a DUI court. You may have a domestic violence court. You may have other ones. We feel that these are the 3 that we can successfully operate in Kentucky that are strong and sound, and that we can have fidelity to a model. So those are and there is a need for all 3 of the programs.
Thank you. Representative Sharp.
Thank you, Madam Chair. I really don't have this question as much as I do a comment. And as a active duty retiree, I really appreciate what you're doing with the veterans, and would like to encourage that and try and encourage opening up more courts, maybe regionally throughout the state. I think might be a good idea. Mm-hmm. Thank you.
Representative, thank you for that. We do, like I said, we have the ability to take veterans from other courts in counties nearby, as long as they can travel to Christian County for court, as long as they have that ability and they can do their drug testing in their home county. We can arrange that. So we do try to accept people from other courts. I've got the gentleman I talked about. He's on probation out of Logan Circuit Court, which is 2 counties to the east of us, and he lives in Muhlenberg County, which is northeast of us. So we're supervising him for Judge Hendricks out of Logan Circuit Court, and we're happy to do that. So
thank you.
And on that note, what is the determining factor as we might consider locations for other specialty courts? In particular, I represent the Northern Kentucky area, and I see an enormous population, but very little focus on even the mental health court in particular, but wondering how those are determined.
There is a mental health court in Northern Kentucky that does not have AOC, is not AOC funded. And so there is a mental health court and Veterans Treatment Court and drug courts in Northern Kentucky. And I will say that for the veteran population, we have been strategic. Hardin County, Fort Knox, Christian County, Fort Campbell. Louisville and Lexington have major VA hospitals, and so they draw a veteran population there. Eastern Kentucky, our Floyd County program, does operate on a regional model to allow people to attend virtually or remotely if they can to fully service Eastern Kentucky. We do have interest from other locations to expand, for example, Veterans Treatment Court, most certainly. The first step that we look into to see is do the cases that are serviced in that county underscore that there is a high enough veteran population that we can put a staff person there and have a full-time workload in that area to fully service. So that is definitely the biggest concern is because if we can't, we can still service that person and provide the support in a drug court, right? So, or a mental health court if that's available. So the models are similar enough that you can still give that person that intensive supervision in a different model. And so it really boils down to, are there enough people in that community that need a veterans treatment court? There's enough of a veterans population coming in and out of that judicial system that it makes sense to put the staff and the resources there in that area. We do have a short list of communities that have been advocating for quite a while for a veterans treatment court. And so for the mental health courts, we were very strategic in where those were placed based on the frequency of mental health related cases in those areas. And and I can go back to the map, if you look, it's really close to several of them, for example, Christian County Western State Hospital, right? So we were intentional to make sure that all of our catchment areas for our mental health hospitals in the state of Kentucky had a mental health court in its near vicinity. We also based that decision based on the need that we would see, the frequency that we could properly staff those courts. It's important that we're able to, use our resources to the best of our ability. So we first looked at the frequency of mental health cases that were coming through in those communities. We looked into the judicial buy-in that we had. Will we have judges that will be willing to do it? So Judge Cutoff was one of the first judges that says, I recognize the need here in my community. I recognize that us not adequately serving, and I'll let you speak to that. And so that made it a really good fit for a mental health court. You want to speak on?
And I would like to speak up, Audrey.
There she is.
That part I've finally joined.
Yes, thank you, Judge. We appreciate you. And if you would, please introduce yourself for the record and welcome. We understand from Colorado to Kentucky.
Actually, Oklahoma.
Oh,
Okay.
I'm Judge Catherine Gabhart. I am General Circuit Judge for Scott, Bourbon, and Woodford counties. I have been a drug court judge for 3 years, and I now have started a mental health court. Our first docket was in November of last year, so we have less than a year in our mental health court. I'm currently at the All Rise Judicial Training for Specialty Courts, so right on target for what we're talking about today. My drug court right now, we have approximately 60 people in our drug court, and we could accommodate more. Right now we're in a transition period trying to get another staff member. I will say it has been difficult to keep staff. We have 3 positions in our drug court, but the positions aren't paid very much. I don't know if Audrey touched on that in her presentation, but oftentimes our staff members, once they get trained and they're doing well, they can get jobs in the executive branch and make more money. So we have had a lot of turnover, and it's hard to keep people in those positions. The people who do stay have a big heart for the program, and they're willing to stay in the program to take less money. But I would like to see if there's any consideration in granting funds to pay our drug court personnel more, because they work hard and it takes a lot to run these programs. Our mental health court has one staff member, and she was our program coordinator for drug court. I brought her over into mental health court. And so we can only accommodate 25 to 30 people in our mental health court because we only have one staff member. In the short time that we've been running our mental health court, we've now accumulated 21 participants, and we have more than 4 pending to come into the program. So we will be close to capacity in less than a year of running the program. I do see a need of having more staff if that can be accomplished. But there are so many counties that I know who want to have mental health courts that have first choice. So if there's any money that's allotted for increasing the number of mental health courts in the state, that would mean we would have to wait a long time before we could get a second staff member in our program. So we have to make sure that we stay at around 25 so as not to overwhelm our staff member.
Thank you. As we prepare to wrap up our questions, we do want to better understand what the costs are. And as you mentioned, specialty, you take on additional responsibilities to that. Is there a shift from the costs that might be not now spent in a general court and you're able to receive that person in a specialty court? Are you able to shift some of those dollars? Are we seeing savings because we're not seeing that same person in a different courtroom? Can you help us understand how those costs have perhaps shifted over this 20 plus years that this has been in process?
I'll try that one. As Ms. Collins said earlier, when somebody's in drug court, they're supervised by drug court. They're not on the probation and parole list necessarily for an officer. Now, I will say in mental health court, we do use probation and parole for those who have a probation officer. And our regional office manager is on my mental health court team, and he comes to every meeting, and they supervise people and they do drug test people because, again, that's a different population and they need different things sometimes. Obviously, the cost of incarceration is high, and for every one of these people that we can have in a specialty court, the cost of handling their case is far less for each of them. So for all these hundreds of people doing specialty courts, that's hundreds and thousands, if not millions of dollars that's saved on cost of incarceration. I'm like Judge Gabhart. If I could take more people, we could. When we started mental health court in Christian County, I had prosecutors, I had circuit judges, and everybody else going, oh, I've got cases for you. I know this person. I know that person. I mean, it's like, oh, they've been on my radar for 3 years. I mean, so there's no lack of possible participants for these programs. They help a lot of people, and they could help so many more with more funding. The 10 mental health courts that you gave us in the last budget, we truly, truly appreciate, but there are other places throughout the Commonwealth, and I'm looking at the map now, there are big pockets where there aren't any. So, and I guarantee you, and you know this, that there are people with severe mental illnesses in those counties, and some of them are going to commit crimes. They're going to be legally competent, so they could go to trial or they can enter a plea, but they could receive services and live a much better life that way than going to prison or going to jail or not getting the services, even just being out on probation and not getting services. They're more likely to reoffend if we just throw them back out there and say, do your best, because some people just can't do their best without help. So.
And I would just procedurally, I'm sorry, Judge, I just got one little tidbit. So procedurally, once someone is arraigned, referral to specialty court can happen immediately, and research would also suggest that it does happen as soon as possible. So once someone is placed in a specialty court for their criminal proceedings, then that they're not also continuing to come on the criminal docket and have to be serviced on the criminal docket. They are just being serviced on the specialty court docket.
Great.
I would like to add to the cost savings. My mental health court, we applied for a community corrections grant to provide wraparound services. So through that grant process, we have to provide data. We've, based on the data that we've submitted to the State Community Corrections Board, our mental health court in just 8 months had a cost savings of over $900,000 for deferred incarceration. So we're talking less than 25 people in less than a year had a cost savings for not being incarcerated of almost $1 million.
That's very helpful. That's very quantifiable. One other factor that you mentioned was federal funds and the use for the system, onboarding a new system. What would you anticipate in the upcoming year budget cycle as to federal funds that might be effective for your courts?
So, how you're asking how much federal dollars do we anticipate we'll have next budget cycle? It's an interesting time that you've asked that. Out of I think we have around 7 federal grants at the moment. 5 of them are up for no cost extensions, which means that any money that was originally awarded, we can seek to use for an additional year. So we will learn in the next 30 to 45 days if those no cost extensions have been awarded. So in the fall, I'll know a more accurate number as to what we will actually have next year, just because of the timing that we're in right now.
Thank you. That'll be helpful to know more on that.
Madam Chair, may I add something? We're talking about cost of incarceration a lot. Cost of hospitalization at one of our state hospitals, Western, Central, Eastern State, is huge. And for mental health court participants, those people have gone to those hospitals on several occasions. And if we can keep somebody from a 30, 60, 90, 360-day stay there at a hospital and support them in the community with community resources rather than the cost of hospitalization at a state hospital, I don't have a number, but I know that's a large number also. So it's not just the cost of incarceration that we're avoiding, but the cost of involuntary hospitalization is also pretty dramatic.
Absolutely. Are there any other? I'm very grateful for you taking the time to come see us this morning. And thank you, Judge from Oklahoma, from Kentucky, but joining us from Oklahoma. Thanks for being here this morning. Yes.
I appreciate all of your time and your consideration.
Thank you. And as we continue during this legislative interim, as you're able to assemble some of those financial numbers, we do care to know. And I know my co-chair works with diligence in that space as well. So we'll look forward to that information. Thank you. Is there any other business before the committee? Our next committee will be in September 17th. And with that, we are adjourned.
Thank you very much.
Thank you.
Thank you.
Bye, Judge Gabhart.
Thank you, Judge.
Bye.